These days, Americans drive nearly twice as many miles as they did in 1980. Since so much time is spent in vehicles, the reality is that even the most careful driver will probably be involved in a collision at least once in their life. Making sure your child is safely secured every time they ride in a car is the best prevention for injuries or death. California law requires children to be properly restrained in a car seat or booster seat and in the backseat of the vehicle until they are 8 years old or 4 feet 9 inches tall.
The unfortunate thing is that many children involved in a car crash would not have been injured or killed if they would have been properly secured in a child safety seat. We want to do the right thing for our children, but with so many vehicles on the market and hundreds of car seats available, choosing the right car seat and using it correctly can be complicated. We immunize our children to decrease their risk of getting sick. In the same way, properly securing them in a car seat can decrease their chances of being injured if there's a car crash.
Now let's talk about school-aged children. When your child has outgrown his or her forward-facing seat, he or she is ready to be moved into a booster seat. Booster seats protect children by increasing protection from injuries in case of a crash. They are a middle step between a car seat with a harness and a seatbelt to protect children who are too large for a car seat and too small for a seatbelt alone. Many booster seats have weight ranges starting at 40 pounds and ending at much higher limits. Many children are moved out of booster seats before they're big enough to safely use just a lap and shoulder belt. If a child is too small for the seatbelt system, the lap belt may lie across the child's stomach instead of the hips and thighs and cause injury to the internal organs during a crash. The shoulder belt may also rub against the neck, causing the child to move the belt behind the back or under the arm. This crash test footage shows the difference between a child that is correctly secured in a booster seat and one that is only using a lap belt. Children using only the lap belt across their stomach are at greater risk for injury to their intestines and spinal cord during a crash. A booster seat simply raises your child up so that the adult seat belt will fit safely. Older children may be more comfortable in a backless booster. However, a high back booster must be used when the vehicle does not have a tall back seat with a headrest. Again, read the manufacturer's instructions because some require high back boosters to be used with vehicle head restraints behind them. Always use a lap and shoulder belt with a booster seat. Booster seats must be used until your child can safely fit into a lap and shoulder seat belt. Here are a few simple points to remember for school-age children riding in a booster seat. Always secure your child in the back seat. Booster seats are for children who have outgrown the height or weight limit of their forward-facing car seat. Booster seats must always be used with a lap and shoulder belt. When riding in a booster seat, the lap belt fits low and snug below the hips and the shoulder belt crosses the collarbone and center of the chest. Remember, when your child is not riding in the vehicle with you, securing the empty booster seat with a seatbelt will keep it from flying forward in the event of a crash.